Hey everybody, it's Dr. New with a new series that we're calling New Knows. In this, we will do a brief overview of topics of interest in the world of integrative pediatrics. So we're going to start the series with this idea of cerebral folate deficiency. Did you know that 70 to 75% of kids on the autism spectrum have autoimmune antibodies against folate receptor alpha? Why is this important? Because folate receptor alpha is the primary transporter of folate into the brain. So you can have normal or even high folate levels in the blood, but it does not get transported into the brain, and that creates problems. So how does this manifest clinically? Well, for starters, it is a cause of a particular type of seizure disorder that is folate dependent. So if the folate levels get too depleted in the brain and there's a susceptibility, it can create a fairly severe seizure disorder that can be corrected with folate. The second thing is it is a potentially reversible cause of autism. That's important to remember. And then the final thing is that one of the biggest contributors to this idea of language regression. So when we have a kid that has developing language and suddenly starts regressing, start thinking about folate receptor antibodies. Why does this happen? Well, one of the biggest contributors to folate receptor antibodies is exposure to cow's milk, to dairy. So dairy will stimulate the production, and again, this is mainly cow dairy, but any dairy potentially could, but it will stimulate the production of autoimmune antibodies against that folate receptor alpha that will inhibit that receptor. Now, fortunately, we have a second receptor that will transport folate into the brain, but this receptor is not particularly sensitive to the effects of folate, so you have to load it up with large doses. What is the solution to all these problems? Well, number one, be aware of it and test for it. There is a lab called Religion that actually will test for autoimmune antibodies against folate receptors. And second, the solution is to use very high doses of folinic acid or methylfolate. Folinic acid is convenient because it is designed to be taken in high doses. The doses that are in the literature from researchers like Dr. Quadros, our own doctors Fry and Rosignol, these doses are between 1 and 5 milligrams per kilo of body weight. Remember, 1 milligram is 1,000 micrograms. Typically with folate dosage, we're talking micrograms. So these are huge doses of folate. You start these doses and you start to look for reversal of the symptoms. The biggest side effect is it can make the kid hyper. Normally that will calm down after a week or so, and initially it can't interfere with sleep. Simple solution to a very complex problem. Remember, language regression, regression into autism, seizures that are not responding appropriately. Think cerebral folate deficiency and folate receptor antibodies. So this is Dr. New, and now you know.